my eyes just feel like I have grit in them. They're really dry and they're very painful, you know, to keep them open. And I keep blinking to try to, you know, moisten them, but it doesn't work. So anyway, that's why I'm here.
Okay, so I'm gonna go ahead and perform an eye assessment on you.
Okay, all right.
Fine.
Sure.
So you're gonna be inspecting, the first thing is inspecting for position and alignment. So you're just gonna look at her eyes and you're gonna state, eyes are symmetrical and equal in position, okay? That's all you have to say. Then you're gonna go and inspect eyebrows, eyelids, and eyelashes, and you may wanna verbalize it so that your partner knows that you're gonna touch their face, okay? So Teresa, I'm gonna inspect your eyebrows, eyelashes, okay?
Okay,
So I'm just gonna push your hair out of the way,
okay.
okay? And then you don't have to touch the eyelids, just make sure that you're looking at them and then the eyelashes, and what you're gonna say is no abnormalities noted to eyebrows, eyelids, or eyelashes, no styes noted. What other things occur within the eyes? Drainage, okay? And no patchy hair marks on the eyebrows, okay? These are just things you can verbalize. You can say what you want just so that you know that nothing is abnormal. And then you're going to evaluate cranial nerve 2, which is the visuals by confrontation, okay? So Teresa, I'm gonna actually check your confrontation, which is a test to make sure that your vision is okay.
Okay.
I'm going to be having some fingers that I'm going to actually put in 4 different directions.
Mm-hmm.
And I'm going to ask you to let me know how many fingers I'm holding.
Okay.
Okay?
Okay.
Are you ready?
Yes.
Yeah, I'm sorry. Make sure that they cover the eye. And normally within this test, whatever eye that they're covering is going to be pretty much the eye that you're supposed to actually cover the same eye. And you're supposed to be at the level of the person. This is something we forgot to tell you.
Yes,
Did you do that in your
thing? That's what I mentioned in my assessment. We weren't at eye level, and you need to be at eye level.
Yeah, so if the patient's sitting, you have to sit. And then if the patient is standing, you should stand. Okay.
And one thing I wanted to mention is, see, she was standing above me, and she had her finger way up here. That's not an accurate assessment.
Do you want to stand?
Yeah.
Okay. And so basically, the person who's doing the exam, all right, is actually covering the same eye, okay?
I'm trying to be eye level.
So that we can see whatever she sees, I'm sorry, it's so short, huh? Whatever she sees, I should be seeing at the same time. And that's the purpose of this, okay?
Yeah.
Do you mind doing the other eye, because I'm right-handed?
Sure, yeah.
Okay. All right, Teresa, so let me know when you actually see my fingers and let me know how many you see, okay?
2.
Okay. It's the second position, guys, okay?
1. 1. 2.
You look down. Okay, and that's what cranial nerve, you guys?
2.
Okay, so what you guys are going to verbalize is cranial nerve 2 intact. Yeah, you can sit down.
Okay.
So you're doing above, side, and
Yeah,
under?
it's 1, 2, 3 at an angle here, okay, and then 4 is right up the chin. Okay, what's the next one? The lateral apparatus, lateral gland, and punctate. So basically, what like Teresa showed you, you want to do it on your own eye, so I don't touch you because my hands aren't clean. Okay, and that's basically what you're going to do. Okay, and you're going to be looking at the gland inside, right?
Right in
And the
here.
punctate, which is on the inner portion of the eye.
And the nasal right in here. Here. This is where the gland is itself, but right in here are where the ducts are, right in there. This is where you'll see swelling if it's obstructed. You're going to see swelling here.
So what you can say is no
Redness.
swelling, redness, noted. Okay, that's all you have to say. And then you're going to actually, the next thing you're going to do is inspect the conjunctivi and the sclera. Okay, so that's when you're actually going to go down. I don't want you guys to go up.
Just go
Okay,
down.
just
and
go
look.
down.
Have them turn side to side, their
And
eyes.
yeah, have them turn side to
Up
side so you can visualize
and side to
everything.
side.
And what you're going to say is conjunctivi, no abnormalities noted, no redness, no drainage. Okay, and then also the sclera, and the sclera is the white portion of the eye. Okay, and you can say no opacities noted. The sclera is white and intact. Right. Anything else? Anything else you guys saw in the book? Inspect the cornea for opacities and iris for symmetry, okay? So you don't necessarily have to pull the eye down for that. You can
No,
actually
you can
see
just
it,
look,
okay?
yeah.
Cornea without opacities or with no opacities noted, and then iris are symmetrical, okay? That's all you have to say. And then cranial nerve 3, that's when you're going to take your pen light. Okay, and you're going to tell your partner, I'm going to go ahead and check your pupils, okay, and whether or not they constrict to light. You're going to go ahead and do both eyes. Okay, and now you're going to check for accommodation. Teresa, I'm going to ask you to just kind of keep your eyes focused on this pen here, okay? Now, some people do it with the light, some people do it without the light, so you might see both, all right? That's kind of really annoying if you're pointing the light that way because their eyes are converging, okay? You don't have to go too deep, okay? And basically what you're going to say is pupils equally round and reactive to light and accommodation, okay? And you can verbalize that there's convergence, and then you're also going to say cranial nerve 3 intact, okay? And then the last one you're going to do is cranial nerve 3, 4, and 6, and that's the extraocular movement. So Teresa, I'm going to actually move my finger, and I'm going to ask you to move only your eyes, okay?
Okay.
In the direction that my finger is going.
Okay.
Okay? Are
Yep.
you ready?
Yeah.
Okay. Always go back to the center, guys. There were people that were doing this. You always have to go back to the center. Okay? Up. Okay, cranial nerve 3, 4, and 6 intact. Okay, and that's it.
Remember